On January 21st, Taiwan announced its first case of COVID-19. On January 31st, Italy saw its first positive case. Only 10 days apart, yet Taiwan just has over 200 cases with only 2 deaths. Italy, on the other hand, has over 70,000 cases and more than 6,000 deaths, overtaking China's death toll where the virus originated. So what did both countries do so drastically different? Taiwan, an island of 23 million, is located just off the coast of China with over 800,000 of its citizens living and working in mainland China.
There were models that predicting Taiwan was going to be maybe the second or the third affected outside of China.
That's Dr. Jason Wang, a pediatrician and director of the Center for Policy Outcomes and Prevention at Stanford University. He wrote a paper on Taiwan's approach to the virus.
I think what Taiwan had done correctly was that after SARS, they set up this National Health Command Center that integrated all the agencies. And so then all they need to do is to activate the Epidemic Command Center.
Almost immediately after getting news about an unknown virus from Wuhan, China on December 31st, officials in Taiwan began restricting flights to and from the region.
It was able to quickly integrate the national health insurance data with the immigration data so that at the outbreak of the disease, they would know who is traveling from Wuhan, for example, Wuhan, China, where the outbreak is. And that had allowed the system to alert the doctors who are seeing the patients, oh, this person has a travel history, but maybe I should ask a little bit more about the travel history and about symptoms like fever, cough, and so forth. And they did it in one day. And that's because the data was, the two sets of data sets were already there, and they just were able to link it for emergency purposes.
On top of that, hefty fines were imposed on people who broke self-isolation.
If you break quarantine, they will fine you.
An overall strategy that is now being praised worldwide. Italy, however, wasn't nearly as prepared for what was coming.
Certainly, I think the infection was present in Italy for longer than people recognize, and the response unfortunately started much later in their epidemic curve in Italy than it did in Taiwan. And it was likely circulating in northern Italy for a few weeks before they recognized that it was there and before these control initiatives started to be implemented.
When cases hit over 150 and the third person died, the government scrambled to slow the spread of the virus. Authorities imposed severe measures in small northern towns, including canceling carnival celebrations and soccer matches. Schools and universities were shut down over a week later.
The message was not that clear, was not that strong.
That's an infectious disease specialist working on the front lines of the COVID-19 outbreak in northern Italy.
It was like holiday. Schools were closed, but parents were gathering together their children in order to have the possibility to go to work. And so actually we really lost a couple of weeks in which the initial measures were taken, but were not properly taken.
By March 9th, the entire country was placed under lockdown with nearly 10,000 cases. But still, the message didn't seem to be getting through.
Se ne deve andare a casa adesso, non voglio nessuno. Tutti, dovete stare tutti a casa. Deve andare a...
Dovete stare a casa! Non avete capito che la gente muore? Più di 400 persone al giorno stanno morendo!
Another factor that didn't help Italy's situation, its aging population. Italy has the second oldest population in the world after Japan. And while the new coronavirus does infect people of all ages, the elderly are especially vulnerable. 87% of the deaths in the country have been patients over 70 years old. Other issues which played a big part in Italy's quick spread of the virus, according to experts, include the population's lifestyle.
The structure of society is built in Italy is still very much organized according to families in which elderly people take care of children because parents go to work all day long. And so actually it may be that we have a proportion of children that have got very mild disease. They may even be asymptomatic, but nevertheless will be the carrier to the disease, to their grandparents, so that afterwards they will be affected and die more. And so this is another explanation because of the way the society is built.
At this point, Italy's hospitals are so overwhelmed with patients, many are reportedly dying in their homes, meaning the numbers could be even higher than what's being recorded. The world is clearly being shown the benefits of how Taiwan adapted after SARS. Now countries around the world, including Italy, are taking notes on COVID-19 and will more than likely be better prepared for a future pandemic.
Thanks for watching Global News. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel.